The quality of the Danish healthcare system is a widely debated topic. Some of its supporters say it's one of the best in Europe. Other people have other experiences, saying they're not being taken seriously and prevention is not proper in this system. In this video, I will try to dive into the data, the experience, and try to describe how it works all together so we can together learn how good it really is. So in order to understand the Danish healthcare system, we need to understand how it works and how it is structured. The Danish healthcare system is free for everyone that has a yellow card, which is your kind of residence card, your social security number. And if you live here legally, you have one, and then healthcare system is free for you, funded through the taxes, which are of course high taxes that we pay in this country. The way it works is that the entry point to the healthcare system, regardless of what issue you have, is going to be the family doctor. You are assigned a family doctor based on where you live, and you have to go to this doctor with whatever issue you may have. And this family doctor is going to decide what further treatments you need and then send you on to the necessary department within the healthcare system that will have to do that treatment. Now, there is a free choice of doctor, so if you're not satisfied with that family doctor, you have the option to choose another one and then transfer your files and transfer yourself to that doctor. So that way there is some freedom and there is some protection against having a bad general practitioner that will not provide you sufficient treatment. Now, because there are so many general practitioners, family doctors, that also means that the private healthcare system is not very prevalent. There are very few private doctors and they are very prohibitively expensive. So most people go through the public healthcare system. Now, that is different from our experience as Hungarians, where we are used to a healthcare system that barely works in Hungary. So a lot of people that can afford, they go to private doctors and get treatment privately. We get tests privately, and it is generally affordable for the people that earn better, maybe the upper half of the society. Here in Denmark, this sort of private healthcare is not really available, and that means there is no available part of the healthcare system where you decide what treatments will be offered to you. You know, in Hungary, if you want to get a blood sample done, you go there, you pay for it, and it's done. The Danish system is somewhat different. In the Danish system, because the healthcare is publicly funded, that also means that the family doctor is not only a provider, they are also gatekeepers of the system, that they need to protect the system from overloading. They need to protect the system from doing unnecessary treatments and unnecessary tests so that the capacity of the system kind of remains. So that means if you go to a family doctor in Denmark, you have to convince them that you actually need to be taken seriously and that you might have an issue, because otherwise, on some occasions, they don't treat you, they don't take you seriously, and they tell you to just go home and rest it out. Now, I need to say that our experience with family doctors in Denmark and the healthcare system in general has been very positive. There's very small waiting times, the facilities are clean, the doctors are professional, they speak great English. It also seems to me that the procedure of how they treat patients is standardized. So they tell you what they're doing, they tell you what their diagnosis is, they answer your questions, and they treat you on a very professional level, and that level seems to be quite similar among the people that we have worked with as doctors here in Denmark. The system is also very well organized. The doctor's office that we use and where we go to, they have the option to take blood samples from the finger, for example, and check for cell count and things like that. So they can run some quick tests. They can also take blood tests and blood samples from there and send it to the lab. You can also take a time reservation online, and all of your results are also stored online. So IT is there, the system is there, the infrastructure is there for it to work, and that's really good. Now, I need to say that there in the Danish healthcare system, the publicly funded healthcare system, there is no cover for glasses or dental support, dental care. That means that these areas and these treatments, you will have to pay for yourself privately. There is an option to pay into an insurance called Denmark Sygeforsikring. and that is an insurance company that you pay into on a monthly basis. And if you need to go and get glasses done, or if you need to go to dental care, then the price will be subsidized by a certain percentage based on what plan you pay. This could help you to pay this kind of same amount every month, so it's more predictable. But of course, with any insurance, you end up paying more on the long run. So people like us that have the option to have things like that done in Eastern Europe will probably get better service and cheaper. By the way, if you like this content, please give me a like. It helps me spread to more people. Thank you. Now, the experience that we have and our environment, our friends and people that we speak to, the experience has generally been quite professional. It is very standardized the way they treat patients, and it's very well done. However, we have seen or heard people that were not taken seriously and people that were denied an option to do a blood test. A friend of mine went into his GP asking to get an annual lab test, just a blood test to see if there's any underlying issue. And he was scolded, sent home, saying that unless he has a symptom, they're not going to do that. He needs to pay for that if he wants this to be done. And that kind of shows one of the weaknesses that I think the Danish healthcare system has, is that prevention doesn't really happen. Prevention doesn't happen through the healthcare system. People are healthy, but that's because they eat healthy, they work out a lot, and also they don't stress too much about work. The general way of life in Denmark is something that makes it possible to live healthy and live long, but the healthcare system doesn't seem to be very good when it comes to prevention before the symptoms arrive. After the symptoms arrive, the system makes a good job of keeping you alive for long, but they don't place that much of an emphasis on prevention. Now, we have also heard from experts that conditions that don't have quite clear symptoms, such as insulin resistance or PCOS and similar illnesses, are not being taken seriously. Patients have to fight their GP to be taken seriously, and the first reaction by the GP seems to be to send them home, ask the patient to rest it out. And it's quite difficult to rest out a disease that is in connection with your metabolic system. It's kind of impossible, and the only thing that these doctors do if they send home these patients to rest it out is to prolong their time before the diagnosis happens, and that's not good. Now, it's also true that a lot of times if you move to Denmark and have a previous condition, the doctors here will not believe the diagnosis that is being done by doctors in other countries. That could be a systematic thing. It could be that they want to confirm everything in their own system so that they can justify the spending on that specific treatment. But it's also not very good to the people that go through these things. If you have a condition that takes a long time to diagnose, and you went through that, and you went through the inconvenience of having it diagnosed, you probably won't want to go through that route again here in Denmark, especially if you need to take medication for that. And if diagnosis means you have to go off those medications, you have to wait for the symptoms to come back, suffer those symptoms, have those symptoms diagnosed, and then get back on the treatment that you were originally. So this is one point where I think the system could be a little bit better. Now, all of that is, of course, personal experience as well as what we hear from friends and people around us. But if we go and look at what the statistics say, maybe we get a more balanced view. So first thing to look at is life expectancy. How long you can expect to live. That's kind of an important thing, right? If you look at that data, we see that Denmark is doing pretty good. The life expectancy at birth is 81.3 years. So you're gonna live statistically 81 years. And that is in line with what the GDP of the country kind of predicts, right? The more GDP a country has, the longer people live. We can see that Denmark is in the same group with a lot of other European countries. It is better than Germany. It is better than a few places, better than Finland. It's better than the United Kingdom marginally. But you can also see that there are countries that do better. There are countries where the GDP is significantly less, but people still live longer. Those are usually the Mediterranean countries, like Italy, Spain, and also Malta seem to be very good in that sense. But it's also worth pointing out that even Sweden, where the GDP is marginally less, people live almost 2 years longer on average. So while it's pretty good, there's certainly place for improvement. Another interesting thing to look at is how long you live is probably one thing, but how long do you live healthy is probably even more important. And that's another statistic that is done by Eurostat recently. The statistic shows how long people live without any significant health issue, anything that would limit their quality of life. And we can see that for women, Denmark has the worst data within Europe. And that's quite interesting. They only live 54.6 years without significant health issues. Malta, on the other hand, has 70.3 years for women, 70.1 years for men. In case of men, the figure is somewhat better. For Denmark, it's 57.1 years. Again, it shows you that things could be improved. How long we live is one thing, but how long we live without health issues is also more important. And how healthy are we going to be when we retire is probably also quite important. Another thing that I would like to show you is how probable is it that people live to retire. How many people reach the age of 65? In the European Union, we see that for females it's 89, and for males it's 77.4% of people that are going to live to be 65. If you go to Denmark, the figures are much better. So the system is quite good at keeping you alive, and roughly 90% of people, 92% of females and 88% of males live to be 65. So that's good, because that means 90% of people actually get to retire. Retiring age today being 67, they talk about increasing it to 69. So if I were to look at this data in a pessimistic way, that also means 1 out of 10 people doesn't live to retire. We should also talk about what the screening program is, and it seems to be very similar to other places and other countries. So the problems that the system might have is not specific to Denmark, it's more specific to, I guess, modern medicine. We see that there is a program for breast cancer for women at the age of 50. There's also a testing for cervical cancer for women aged 23 and above, and bowel cancer starts at 50. And that's roughly the same figures as they have in Germany or France or the UK, for example. But there is, as far as I know, no organized program for prostate cancer, for example. So if you look at the reasons for death, we can see that generally the biggest cause of death in Denmark is cancers. The second one is cardiovascular diseases, and then respiratory, and then dementia. So cancer is the most important thing. If we look at what kills young people under the age of 49, we also see that cancer is still the top thing that kills people. So all in all, if we were to summarize how the Danish health system works and how good it is, we can see that it's pretty good, as it should be, based on how much money is being spent at the system and how much GDP the country has. The system works quite well, but it's highly dependent on what family doctor you go to. That is something that you need to be very decisive about, and if you're not satisfied with your family doctor, you should look for another one and change until you get better treatment. With that said, that's my experience, and if you have something to chip in, if you have been treated well or bad, I'm very looking forward to hearing that. So if you do, please give me in the comments. I'm looking forward to reading all of your comments. Thank you for watching this video. If you liked it, please give me a like, it helps a lot. And you want to see more than that, please hit the subscribe button. That way you get notified of my future videos. I thank you for watching this one, and I will see you in the next video.